Hello, everybody. My name is Helena, so I'm a pharmacist at the Kolebu Teaching Hospital, and I'm very excited to share with you the results of our recent study on compliance to guidelines in the management of uncomplicated urinary tract infections. Now, why uncomplicated urinary tract infections? Because it is a major cause of hospital visits and antibiotic use in Ghana. The standard treatment guidelines aim at promoting rational antibiotic use as a means of reducing antimicrobial resistance, but there is a general lack of local and national data on compliance to these important guidelines, and is the reason why we conducted this study. We extracted data from our electronic medical records of all adult patients with uncomplicated UTI between October 2019 and October 2021. We also designed a computer program to assess whether the antibiotic prescribed complied to that in the guidelines with respect to dose, duration, and frequency. Now let's focus on three interesting findings. First, out of the total number of adults with uncomplicated UTI, 40% of them did not receive the recommended treatment. Secondly, men were 5 times more likely to get an antibiotic not in line with the STG compared to women. And finally, even though the STG recommends 10 to 14 days treatment for men in uncomplicated UTI, more than 90% of the men in this study did not get that. Now, what will happen if almost half of our patients, especially the men, do not get the right antibiotic treatment for UTI? There can be progression from uncomplicated to complicated disease, with resultant increased healthcare costs for both the patients and the nation as a whole. It can also lead to antimicrobial resistance and even death. Based on our findings, these are recommendations to the management of the Kolebu Teaching Hospital. Let's institute an audit feedback system by leveraging on the EMR to promote compliance to guidelines within a comprehensive antimicrobial stewardship program. Let's also examine the reasons for the poor compliance found in this study. To the National AMR Committee and the Ministry of Health, let's promote similar studies across the country and also consider revising our current guidelines based on recent evidence. In summary, patients are not receiving adequate treatment for uncomplicated UTI, especially the men, and there's a need for regular compliance audits to promote rational antibiotic use. A very big thank you to the following people and organizations for their support. And here is a link to our published paper, as well as my contact details for further discussions. Thank you all so much for your attention.